Welcome back. July is Cleft and Craniofacial Awareness Month. So the CDC estimates about 1,050 babies are born with a cleft lip or without a cleft palate. However, new advances in medicine, meaning more treatment, helping kids lead more normal lives. So on this Medical Monday, we have Dr. Charlene Aboutanos with us from the Bon Secours St. Mary's Cleft and Craniofacial Team. Thank you so much for joining us here today. So talk to me about this month and the awareness of this. So what is National Cleft and Cranial Awareness and Prevention Month? And then also, why is it so important to talk about this?
Yeah, so July is Cleft and Craniofacial Awareness Month. It's important not only to increase awareness to the general public, but also to educate the public and to advocate for our patients. So we take this time to share some of the things that we do.
And so talk to me, can you explain what cleft and craniofacial conditions are, and then also how common are they in the U.S.? I mean, I know I was going through some numbers there off the top, but for those who don't know or understand, what is it?
Sure. So the most common cleft condition is like a cleft lip and or a cleft palate. So a cleft lip is an opening in the upper lip, and a cleft palate is an opening in the roof of the mouth. Okay. And babies can have either one by itself, a cleft lip alone, or a palate alone, or both together. And the incidence is, in the United States, about 1 out of 1,000 babies are born with an orofacial cleft. That translates to about 6,000 to 8,000 babies a year. Worldwide, it's a little bit more common. It's 1 out of 700. And that does make it one of the most common conditions we see.
And how does having a condition like this impact a child? I mean, obviously there's the vanity part of it overall, but there are other conditions that are that come from it too, right?
Yeah, so it can affect the child's ability to feed or swallow, also their speech. Yeah. It can affect their teeth, and it can affect their hearing as well. Oh. So we try to make sure to guide the family, guide the baby through all the care needed to get them to be successful in all those areas.
So let's talk about advances in treatment. I mean, how have things come from, maybe a decade ago to where we are now in terms of treating and caring and making sure that everybody gets attention? Yeah,
so probably the most significant advance recently is through imaging. There's now prenatal imaging. We can diagnose this before a baby is born in some cases. Okay. Also imaging through the dental, orthodontics offices, oral surgery offices. All that imaging can be helpful for surgical planning. And then another advance more recently is genetic advancement. Okay. That can help us diagnose conditions that are tied to genetics.
Oh, wow. Yeah. And then, so talk to me about early diagnosis and then also a coordinated care team. Yeah. How do having both of those in place help with outcomes here at the end of the day?
Yeah, so like I mentioned earlier, prenatal care can be done, before the baby is born. We meet the family almost immediately and then explain to them, educate them about the condition and all that is involved in caring for their child. We introduce our team members. Let them know that we're accredited. We're like the gold standard for taking care of kids who have cleft and craniofacial conditions. Oh, wow. And also helps soothe their mind, maybe take away some of the worry during their delivery so that they can enjoy their child.
Oh, my goodness. Yes. Well, we appreciate all the work you all do and the team does and everything. And very important to bring awareness to Cleft and Craniofacial Awareness and Prevention Month. So, Doc, thank you so much for coming in. We appreciate it tremendously.
Thank you for